Hi, I'm Dr. Kelly Starrett from the Ready State, talking about how we integrate the use of the H-Wave OTC into pain and swelling problems in the back of the calf or the Achilles area. Now, this is a common place for a lot of people to have a lot of silliness. We can call it tendinopathy, we can call it tendinosis. Most people call it a tendinitis. But really what we're talking about is how do I manage pain and congestion and swelling in an area around my heel. So when we describe the whole system, we're ultimately looking at how some of the calf flexors already cross all the way up at the top of the knee, but all kind of come down and conjoin into this common tendon, which inserts onto the heel. So when we're looking at thinking about the system, we tend to want to kind of hyper focus on my area of pain, which may be in this region, yours may be special, it may be on the heel. But ultimately what we're looking at is how can we get this whole system to work a little bit more effectively. Now, one of the issues with any problem in the bottom of the foot or in the lower limb is that it really exists at the bottom of a gravity well, which means that just standing up, I'm always fighting gravity towards pumping blood and towards sort of returning the lymphatic system or removing the sewage or waste products of the system, of the body system, all the way back up to the heart to be processed. So one of the issues here is that if I've got pain in the Achilles or soreness in this system or discomfort in the system, oftentimes that shuts down how much actual movement I'm doing, and that further leads me into kind of a congestion cycle. So what we're going to do here is think first and foremost, how can I improve the neighborhood? How can we get the groceries in and simultaneously take the garbage out of the system? So keeping in mind that the calf acts like a second heart for the body, that the huge kind of gastroc soleus system actually enjoys a lot of sort of disproportional amount of musculature and energy requirements, because being able to stand and move through the day is really something that humans are supposed to do. We're supposed to be able to walk through the world, interact, think about sort of bringing resources back. That sort of locomotion is one of those central features of being a functional human being in our environments. Now, one of the things that happens then is it's not unusual for us to take the sort of logical leap that contraction of the calf can do a lot towards returning that venous blood supply and actually pumping out a lot of the waste for the whole leg through this lymphatic system. So what we're going to focus on is how do we recruit the most musculature here to help decongest this. Now I'm going to show you my favorite pad placement. I'm going to focus here in this situation on low frequency settings. So I've got the unit turned off, and I'm going to select low. I'm going to show you a couple of my pad placements. One is that I've got a pad placement right in the knee pit. So right behind Margaret's kneecap on the underside of her knee is a great place to pick up a lot of the sort of musculature down below. And then I've moved this pad around a couple times until I found a place where I could get a good contraction. So those two are my first lead. And if I dial this up, all I need to do is dial it up until I start to get a little contraction. You'll notice that I've got a pad underneath Margaret's instep there that allows this foot to move freely and not to become irritated. We're trying not to load the calf, which might limit the amount of contraction we're getting. Now, we can dial this thing way up and get a big, massive contraction. If that's comfortable, that's okay. But ultimately, any movement in this whole calf system is going to be a net positive. The second placement I have is actually on the instep or the arch of Margaret's foot. And then I've got it on her shin here, right at sort of the top of this kind of anterior compartment right below the knee there, where people would talk about having kind of shin-related problems. So right on the anterior tibialis. And what's going to happen here is I'm going to now dial it up a little bit, and we're going to start to see we pick up a little bit more co-contraction. All this is happening together. It's acting like a ringing system to help decongest the entire system. Now, the key here is that if we can use this in a way where I can get little doses throughout the day, that's going to be a much better solution, because I'm going to be up, walking around, and the tissues are going to become congested. And this allows me to get some 20 to 30 minute sessions in, which would be the same thing as riding a bike or going for a walk. But we'll still take in the morning and the evening if those are the times you have. One of my favorite uses of this with our athletes is to go ahead and decongest all night long. If we can decongest during the day, great, but oftentimes people can start to get this on in the evening and then can kind of reset the clock back to decongestion in the morning. Ultimately, when we have pain in this area, that can be generated by a lot of things. We could have sliding surface problems. We could have Achilles that have been loaded a little bit funny. We could be behind. Our brains could be sensitized. We could increase volume on the tendon too quickly. Whatever the mechanism is, keep in mind that our goal ultimately is to say, how can we improve the health of the system? That this low-grade muscle contraction does a lot to improve the health of the tendon sheath by getting 2 contractions a second for many, many minutes and potentially hours. And what we find is that this sort of repeated low-level, non-fatiguing muscle contraction can go a long ways towards improving the health of the tissue tendon system by decongesting it. And what we find oftentimes is that by changing what's going on locally in the physiology, by decongesting the tissues, we actually see less pain as a result of having less congestion. But ultimately, this is about recovery and enhancing what the body should be able to do anyway. When we're not able to walk and load as much as we want, this is a simple way of basically taking 2 steps every second for many, many, many miles without having to do anything. So again, what we get is a lot of motion without having to have a lot of movement in the system. This is how we think about decongesting a problem in this Achilles area.